Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, Meldita's Info Corner. My FB johnrigacho at yahoo.ca. Okay, so this is kidney transplant continuation. And for now, we will be talking about how to avoid kidney donor rejection. Okay, and soon infection will follow. Okay, there are ways to avoid kidney donor rejection. That is using anti-rejection or immunosuppressant medication. We have also lab works, and we have also appointments with the doctor. Okay, anti-rejection or immunosuppressant medications, what are they? Well, they suppress the immune system, which is the body's natural defense system. Okay, I have an example here of a patient taking 3 anti-rejection medications. We have the tacrolimus, mycophenolate, and the prednisone. And we have here a classification of immunosuppressant drugs or medications. We have 4. We have the calcineurin inhibitors, which act on the calcineurin pathway. An example of that is tacrolimus, and this will reduce the T-cell replication. Number 2 is the anti-proliferative agent or metabolite. An example of that is mycophenolate. It will also reduce T-cell replication. We have number 3, which is the mTOR inhibitors. An example of that is sirolimus, which is not part of the patient's medication. And number 4, it is steroid. An example is prednisone, and that will also reduce the T-cell replication, and it is also an anti-inflammatory. The anti-proliferative agent acts on purine pathway, and the calcineurin will act on the calcineurin pathway. So calcineurin inhibitors act on calcineurin pathway, and the anti-proliferative agent will act on the purine pathway. And how will these drugs work anyway? Okay, let's see. Well, they prevent or inhibit the following. We have 1, cell activation. So it prevents cell activation of the lymphocyte. They also prevent the cytokine production, prevent also differentiation, and these drugs will also prevent proliferation. Okay, so this is how these drugs work. They prevent lymphocyte cell activation, they prevent cytokine production, they prevent cell differentiation, and they prevent or inhibit proliferation. Okay. So, immune system. We have an immune system that will protect our body from any invading organism or any toxin from any organism. So in here, the most common cells here, we have lymphocytes, the T lymphocytes and the B lymphocytes. We have the neutrophils and the monocytes. As you see here, we have here the following cells that are on guard, okay? So let's say the immune system will see something different inside the body. It could be a foreign cell or anything, an intruder or anything. The immune system will alert these T lymphocytes and get ready with their cytotoxic chemical. The B lymphocytes will get ready with its antibodies. We have the cytokines with interleukins from helper T cells and macrophages. And we have also the inactive to active role to effector cells, that is via differentiation. Okay, so that's fine. We have a good immune system. It is alerted. It sees something unusual or, alien. Yes, it will start acting right away with the use of these following cells. Okay. However, because we have here a kidney transplant patient using anti-rejection medications, these medications will suppress or depress the immune system. So because even if the immune system will see that we have a kidney donor inside the patient's body, there's nothing it can do because the anti-rejection or immunosuppressant medications already depress his immune system. Although his eyes are open, he cannot move. There's nothing he can do. Okay, so thanks to these anti-rejection medications, So this kidney donor, this new kidney of the patient survives. Okay. Now, when will this kidney donor will be attacked? Well, this is what's going to happen. If the patient skips his medications all the time, non-compliant, or just take it whenever he remembers it, there is a big problem. There's a chance that the immune system will wake up and try to activate these cells and attack this kidney donor. So that's the problem. And we don't want the thing to happen. If a day or 2 or 3 days this thing happens, so the patient has to, go to the hospital and, report what happened, because we have to save the kidney. Okay? If the kidney fails for a long time, that he's not doing, he's not compliant or anything, there's a chance that the kidney fails. Well, the patient will be back to the dialysis program. Okay? So he will be back on dialysis because he failed to do his part to protect the new kidney. So it's very important that the patients are compliant with their anti-rejection medication to make this kidney donor work. It's all in their hands. Okay. So taking anti-rejection medications as ordered. The patient has to be in control of his health and medications, and do not rely on anybody, not even with your friends or relatives. Soon they're gonna leave you. So anti-rejection medications as ordered has to be taken by the patient, and be sure that there is a correct dose, correct time, correct frequency. Okay, so be sure that the patient knows the correct dose, the correct time, and the correct frequency. The tacrolimus level, actually, the dose is determined by the blood work level. So if the blood work level is very high, then the doctor will reduce the dose of the tacrolimus. If the blood level is too low, then the doctor will increase the tacrolimus dose. Okay, do not drink grapefruit. The grapefruit will cause, more or increase the serum level of these medications in the blood. So do not drink grapefruit juice because there will be a serious interaction. Okay, if you vomit within 30 minutes after taking medications, let's talk about the volume. If you vomit large amount, take all your medications again. If you vomit small amount, but your medications are mixed with the vomit, take all your medications again. If you vomit saliva and you do not see your medications with the saliva, do not take your medications. Okay, you wait for the next time again. You have a time of your, you have a schedule. You wait for your next schedule to get your medications. The transplant team will give you copies of medications and talk about them, okay, at your own level of understanding and at your own pace. So they will talk about the actions of your medications, the indications, the side effects, and the other warnings. Okay? They emphasize that the patient has to report any unusual problems related to the medications. That's very important. Okay. And the next one, to avoid kidney donor rejection, is keeping up with your lab works as scheduled. Do not skip your appointment. They will get your blood works, and that includes your complete blood count, your lights, your creatinine, the GFR, the urea, the phosphate, magnesium, and the tacrolimus level, and the cytomegalovirus virus. This virus, I'm not saying it will happen all the time.